my name's Caitlin. I'm the esthetician here at Dr. Atagi's, and tonight I'm going to be going over dermaplaning. So for those of you women who are struggling with a mustache, as I am today, I recommend to call ASAP for your dermaplane. All kidding aside, this is not my real mustache, nor do I have one, because I get dermaplaned. So we have Susan here, who is my model. I'm going to be doing a live demo on her in just a minute. But to go over dermaplaning a little bit, dermaplaning is when I lightly glide a little blade over the skin and it gently removes all the vellus hair and all of the dead skin. So all of the vellus hair is the peach fuzz on our face, and so it's a myth. It won't grow back thicker or darker. However, it will grow back in about 3 to 4 weeks, depending upon your hair growth. I usually recommend a dermaplane every 4 to 6 weeks, because we're going to have new skin cells that come to the surface roughly every 28 days to push off the old ones, and it's nice to sort of just give your skin a little bit of help to get rid of all that dead skin. So what this will do is you'll get better absorption of your moisturizer, active ingredients like vitamin C, retin-A's, hydroquinone, all things that are going to improve your skin, all things that you've already invested in. So it's nice to do a dermaplane before events. I always encourage people to do them before weddings. You can do it before photo shoots because the light won't catch the little peach fuzz. Your makeup goes on much smoother. It's a really nice, no downtime treatment for an instant glow. So we have Susan here who I'm going to demo on, and I'm going to start right here. And I don't mind turning to the right. And it's super gentle, and you just glide it over the skin, and you should be able to start to see some of that little peach fuzz coming off, the dry skin. You can see it sort of all in there, right up there. So you can tell she's not red, no irritation. And if you stay tuned for after the Facebook Live, we're going to be posting her before and afters of receiving the dermaplane treatment. And I like to go back over it because you get a little bit more dead skin each time. And this treatment's really good for all skin types. So that's a lot of dead skin. So it's instant smoothness, which we love. So leading up into your dermaplane, you want to make sure that you're going to stop use of retin-A's, glycolics, salicylics, and benzoyl peroxides. You can start back up on these ingredients and products 2 days after. Post-care is pretty simple. All you want to do is a basic moisturizer. Make sure you're wearing lots of sunscreen. You always want to make sure you're protecting your skin anyways. So that pretty much sums it up for the dermaplane. And if you stay tuned next week, we have Microderm 101. It'll be same time, Thursday, 6 p.m. And most important, make sure you book a dermaplane before the end of April. I think it's April 31st. You'll get 20% off your dermaplane. So at this point, I am happy to take any questions.
Out of curiosity, Caitlin, how long does it take to do the full face?
Full face, so it's about a 50-minute treatment. A dermaplane itself is only about 20 minutes of the treatment, but what I like to include with the treatment is going to be a full double cleanse with the Clarisonic. If there's anything to extract, I like to go in there, clean out their pores. And then at that point, I'm going to go in and do the dermaplane. Afterwards, I put a very gentle hydrating mask on with some steam, arm-hand massage, very pampering. It's not just about the dermaplane, but it's about just taking care of yourself.
And if we had anybody call in, either tonight or tomorrow or sometime this week, is there anything that they need to know before coming into the office? Do they need to have a consult?
No, so you don't need a consult. All you need to be aware of is to stop use of those active ingredients, retin-A, salicylic, benzoyl peroxide. They're going to make your skin a little bit more sensitive. So you want to make sure that your skin isn't too overly dry when you come in from using a Retin-A or salicylic. So other than that, you should be absolutely fine.
And you said all skin types. Would that also include dark complexion as well?
Yep. So it's not going to affect anything. It's not going to affect your skin color. It's just simply there to remove all the peach fuzz, all of the dead skin, and that goes for any skin type. It's extremely safe, very soothing. Like I said, you absorb your moisturizers better, so overall you're going to leave feeling more hydrated.
Awesome. Well, thank you, Caitlin.
Yeah, no problem. Thanks for tuning in.